South Africa has an estimated population of about 55 million. When we look at our HIV epidemic, it is one country that has the largest number of people living with HIV. We have a prevalence of 14% as per the 2017 statistics. That translates to about 7.9 million people estimated to be living with HIV. Adolescent girls and young women are largely affected as compared to young boys their age. This becomes a cycle of transmission. So for us to cut the links, we need to work with the men. If we look at our 90-90-90 targets, we'll see that as a country, we are very close to the first 90. We're trying to ensure that we introduce innovative strategies to reach the men, and HIV self-screening is one of those.
The HIV Self Test Africa project, STAR, funded by UNITAID, began in South Africa in late 2017. The objective of the program is to scale up HIV self-testing in the country, overcome regulatory barriers, and create an enabling environment for partners, implementing partners, PEPFAR, USAID, and the national government to be able to roll out its own HIV self-testing program. Over the course of the last 2 years, the STAR partners in South Africa have distributed close to 2 million HIV self-tests in various modalities. In taxi ranks, we've reached around 60 to 65% of all clients receiving a test being male, of which around 30 to 40% have not tested for HIV before, not tested for HIV in the last 12 months.
Increasing HIV testing uptake amongst men and high-risk groups, and linking those who are HIV positive into care and treatment is a key priority for the national HIV program in South Africa. Limiting cost is an important factor for scalability of HIV self-testing, and sustainable models that do not require additional service provision or staff for the distribution are paramount. 2 public-private partnership models are of particular interest as they do not require additional manpower but are integrated into existing systems. Distribution through workplace programs and distribution through the network of community pharmacies, ICPA, a model that has been used by the government to increase access to public sector family planning products.
Within the workplace programs, we've targeted over 2,500 small and medium enterprises. These are organizations that do not have well-established HIV programs, and their staff are often not accessing the type of services that are required.
Under the STAR initiative, the beneficiaries of the HIV self-screening program is firstly those who work, the employees that work far away from clinics or where they can go and test. Who we are trying to reach is the workplace that is the last mile.
For distribution of HIV self-testing amongst working men, it was important for the employer not to impact on the productivity. It was negotiated that information sessions were conducted during lunch and recreational time. At some workplaces, HIV self-test kits were made available at retail outlets on the workplace compounds so that workers could access them easily whenever they wished to self-test. Employees received information about HIV and prevention methods, the importance of knowledge of status, and then will be shown on how to use the self-test on their own. Employees are encouraged to test with their sexual partners and are offered additional tests for their partners.
My people come from very, very far places. It's very difficult for them to go to clinics. 80% of my employees are males. And obviously when they get here, you know, men are men, I just want them to be safe.
It's the level of education that the employees have. Self-screening does help them because some of them, they don't even know how to contact HIV.
You find questions like, is it still safe to kiss now that it's testing on the mouth? And then we'll have to break it down to them and explain that we're not really testing for a saliva.
Isikhathi sekliniki anginaso ngoba kuthi ngisebenza Monday to Friday and ekliniki bayavala ngoSaturday. So mara sengilento engayiphatha la ngayisebenzisa manga right ngizokhona kwekliniki ngoba kuthi kuna paper lapha iphakathi la kuthi ngali.
The thing that I take in this kit, I'm just willing to know about my status, and also I want to keep myself safe. I think we share everything. So even to test in the same place, that one doesn't have a problem.
Sibanye-Stillwater realized that partnerships are the way to go. Knowing about STAR was an automatic alliance that we sought. What we realized with the pilot initially was that 42% of over 3,000 that came through were people who had never tested for HIV. And that prompted us to think, how are we going to scale up?
So scaling up would be self-test available in all Sibanye operations. The first tuck shop we had for about 6 months now, distributing the test kits. But what is key also is to make sure that we link each tuck shop to a clinic.
The biggest reason for us looking at it is, firstly, confidentiality. The employer, he gets the test, he goes home, tests himself, and then from there on he can decide with whom he needs to share the information.
Also, the negative ones are also encouraged to stay negative. And then there are also condoms that are distributed on site.
Especially in the clay brick industry, I think it would be a good program.
So I'm HIV positive, and I went to the clinic. I had to take my treatment for 3 months. When I went to the clinic, I was weak. I'm now strong enough.
The Public-Private Partnership with ICPA large network of pharmacies offers great opportunities, increasing access to HIV self-test kits to priority populations due to the locations of the pharmacies.
The ICPA, we've got about 1,200 members, 40% of which are in rural areas, 60% in urban areas. And our pharmacies are very often at points where commuters come. So we're near taxi ranks, we are near shops, obviously where the business is. Unlike clinics and hospitals, which can be quite intimidating, especially for men, we sell condoms, lubricants, libido enhancers. So those people are already coming into our pharmacy, and it's a wonderful opportunity to engage them, to say to them, do you know your status? The public-private partnerships that we're going to be rolling out across all of the provinces is NDOH supported to supply state stock, so the stock would be free, to patients coming into the pharmacy.
As the first point of contact with the public, they normally come to us for standard things like your morning after pills. They come for us for medicine advice. We believe that as pharmacists we can play a major role. Public trust us enough that they can hear us when we explain the importance of self-testing and screening, that they may be aware of their status at all points.
Our kits are more offered to students, more especially also the drivers. Remember, we are just near the taxi rank. With this one, it's more easy because they have just to swipe in their mouth.
One of the major challenges for any HIV testing program outside of healthcare facilities is to link individuals who test positive into care and treatment. This is more challenging for HIV self-testing, where we as provider do not know whether the test was used, when it was conducted, and what the outcome of the test was. STAR has developed specific mHealth solutions that assist self-testers not only to conduct the test, but also provide assistance to those tested positive to link into care, and for those tested negative to link into prevention services.
The STAR program has developed multiple digital health platforms to ensure that we are able to engage clients when they've taken a test home. In this regard, we've developed a WhatsApp for Business line, which allows individuals to communicate on our favorite channel. It's fast, easy and effective and doesn't cost the individual much at all. It allows us to get pictures of results, for us to send pictures on how to do the test, for us to send videos, for us to provide the much needed counseling if required. And allows us to capture the very relevant information about, has this person used the test, what was their result, and how do we link them into further services. We've developed an interactive voice response system, which is a toll-free hotline, which accepts both inbound and outbound calls. So a client at any point requiring services or requiring to report their result or link into care can call a toll-free hotline to report their result.
HIV self-test distribution through public-private partnerships, such as workplaces and ICPA, has shown to expand access amongst populations difficult to reach. These models have proven to be cost-effective and are now scaled up in South Africa to address the HIV testing and treatment gap through consumer-powered solutions.